Hello, good evening. Can you hear me? I hope I'm audible. Someone who is attending the session live in the chat, can you just confirm whether my voice is clear, whether I'm audible, visible to all of you? My hello and good evening to all. Whether I am clear, whether I'm audible. So today we are here for Psychiatry MIQ. This session started on YouTube is about most important questions. I suppose students who are attending it live have attempted this MIQ 15 questions test from NEETPG app. Those who have attended may continue to attend this session live. Those who are yet to attend, I suggest you to kindly attempt this on the app and then see the recorded video. Have you attempted the test? These 15 questions are hand-picked questions from 15 different concepts. So in the next 1 hour, you will be taught these 15 different concepts. Along with these 15 concepts, we would like to discuss 15 other topics. We would like to discuss the potential questions for the upcoming exam. Yes, are you ready? So this session is not about just giving you question and answer of those 15 questions which you have attempted. I would like to discuss in this session with you, all of you, the potential question, the new areas. Yes, shall I begin? Shall I begin? The psychiatry question may belong to general psychiatry, that is basic terminologies, may belong to clinical psychiatry, that is the psychiatric disorders, may belong to psychology, that is normal human mind. Are all of you aware that these are three basic main areas in psychiatry? Let's start. 35-year-old woman suffering from recurrent major depressive disorder become very distressed as when the supervisor asks her to revise the project she has been working on for weeks. I don't do anything right. I am the most incompetent person in the firm. I will lose my job for sure. मैंने कुछ सही नहीं किया. मैं ही सबसे इनकॉम्पिटेंट हूँ. I will lose my job. मेरी नौकरी चली जाएगी. A student. I didn't study properly. I am not intelligent. I will not clear this exam. Does that feel relatable to you? Has any of the time during preparation have you felt that you are not worthy? कभी भी पढ़ाई करते समय आपको ऐसा लगा कि मैं तो इस परीक्षा को पास करने के लायक ही नहीं हूँ, काबिल ही नहीं हूँ? Have you ever felt like this? Yes, no. Everyone get these type of negative thoughts, and these negative thoughts are maladaptive, also known as cognitive distortions. Example, overgeneralization. overgeneralization. The cognitive theory of depression states that depression is caused by maladaptive negative beliefs. Is this statement there in your notes? Check. Those of you who have attended my lecture earlier, is this statement there in your notes? Yes, no. Yes. These are known as automatic thoughts. These are known as cognitive distortions. Is this statement in your notes? This question is derived from a PYQ asked in INICET. Do you know that PYQ, or may I show it to you now? Do you know this PYQ, or may I show it to you right now? Which of the following is not included in Beck's cognitive theory of depressive thoughts? Of depression, sorry, not depressive thought. This question was asked in INICET May 2024. This question was asked in INICET May 2024. Automatic thought is same as cognitive distortion, is same as maladaptive beliefs. Answer of this question is introjection. Do you understand how did I derive this as the most important question? हम लोग ये MIQ बनाते कैसे हैं? हम पहले वाले क्वेश्चन को देखते हैं और हम सोचते हैं कि ऐसा पूछ रहे हैं एग्जामिनर. How do we derive MIQ? We look at a previously asked question and we think that what the examiner is asking. Do you get my point? Negative thought is equal to cognitive distortion, is equal to dysfunctional belief, is equal to maladaptive belief. Same thing. It is the way you think wrong. ये आपके गलत सोचने का तरीका है. जैसे आप लोग गलत सोच रहे हैं और आंसर को वर्थलेसनेस सोच रहे हैं. वर्थलेसनेस मीन्स I am not capable of anything. It is not I will lose my job. It is I will lose my job, I will lose my family. I am not worthy of anything. I don't deserve anyone. Worthlessness is a bigger thing than overgeneralization. Overgeneralization eventually leads to worthlessness. Do you understand this? I know you people have marked answer as this or maybe this. This question has been made by me. It is a direct statement from textbook, direct statement from handwritten notes. Suppose one of you say, I marked question number 1 wrong. So, one question wrong means all question wrong. One question wrong means all question wrong. What are you having? Overgeneralization. Suppose you get one question wrong and 14 question correct, and you tell your mother, I don't know psychiatry. You focused on one wrong or 14 right, one wrong. That means selective abstraction. Selective abstraction. And suppose you got one wrong and you tell your mother, I don't deserve to marry. हमारा साइकेट्री का क्वेश्चन अच्छा नहीं हुआ तो हम शादी करने के लायक नहीं हैं. ये क्या है? आर्बिट्ररी इन्फरेंस. These three are called cognitive distortions. Don't mix up cognitive distortion with cognitive triad. Cognitive triad is negative views of self, environment and future. Self, environment and future. I could not do anything in my life. Worthlessness. Nobody can help me. Helplessness. Nothing can be done about my future. Hopelessness. बेटा तुमसे ना हो पाएगा. मुझे तुम्हारे लिए अच्छा बिल्कुल नहीं लग रहा है. तुम्हारे लक्षण बिल्कुल ठीक नहीं रख रहे हैं. तुमसे ना हो पाएगा. रामाधीर. Hopelessness. Is that clear? When to mark hopelessness, when to mark worthlessness. Come on, student, these are your own feelings. Don't you get these feelings while preparing for the exam? I'm not mocking any depressive feelings, but don't you think while preparing for the exam, sometime you get negative feelings, sometime you get negative thought? Be honest with me. When you get a bad score in the grand test or class test or any test, do you feel bad? There are two type of student. One who take failure positively and try to do something better, and one who stop studying after seeing a grand test or a CBT result. क्या कभी ऐसा हुआ CBT या grand test का रिजल्ट आया और आपको खराब लगा? Come on, come on. Now you get it. Is the concept clear? See, we are here to clear the concepts. There are many students who are listening to me right now who are DAM students. There are many students who are listening to me right now who have not been DAM students. But when you are on DAMS-delhi YouTube channel, all of you are DAM students. So irrespective of whether you are taught by me or not taught by me previously, now you know what is a negative thought process in depression. Is that clear? एक चीज तो मुझसे सीख के जाओ कि नेगेटिव थॉट प्रोसेस ऑफ डिप्रेशन होता क्या है. These type of questions can't be mugged up. These type of questions can only be solved by a student who has read in depth. This question differentiate a achiever from a non-achiever. अभी explain किया arbitrary inference, deriving a negative conclusion without sufficient evidence. Question 2. All India PYQ. Which are the following culture-bound syndromes seen in India? Presents with acute anxiety and panic-like symptom. अभी भी कुछ बच्चे कह रहे हैं नहीं समझ में आया. भाई कभी ये सब पढ़ा है आपने? कॉग्निटिव डिस्टॉर्शन, कॉग्निटिव ट्रायड, ये अलग अलग चीजें होती हैं. डिस्टॉर्शन मतलब नेगेटिव बिलीफ पैटर्न्स. डिस्टॉर्शन मतलब रॉन्ग वे ऑफ थिंकिंग. ट्रायड मतलब नेगेटिव व्यूज ऑफ सेल्फ, एनवायरमेंट एंड फ्यूचर. ये बहुत बेसिक चीज है कि यही आगे जाके ये बनता है. डिस्टॉर्शन प्रोग्रेस टू ट्रायड. कम ऑन, स्टिल सम स्टूडेंट्स आर नॉट क्लियर. डिस्टॉर्शंस में आता है ओवर जनरलाइजेशन, सिलेक्टिव एब्स्ट्रैक्शन, आर्बिट्ररी इन्फेरेंस. इसमें आता है वर्थलेसनेस, हेल्पलेसनेस और होपलेसनेस. इनको मिक्स मत करो. डोंट मिक्स देम. ये भी गलत किया. क्वेश्चन 2. कम ऑन. acute anxiety and panic. Anxiety of disappearance of genitalia. My genitalia is decreasing in size. and I am becoming weaker. One day it will disappear and I will die. This is called Koro syndrome, Indian origin syndrome. Dhat, also asked in AIPG. The word dhat means dhatu is equal to semen. In this, the patient feels loss of semen is loss of energy. Sometimes he says loss of virility. मर्दानगी खत्म हो रही है. I am losing semen day by day, therefore I am becoming weaker day by day. That loss of semen could be in the form of masturbation. That's why people presume that masturbation make you feel weak. Have you heard this from any young boy? One boy mocking another boy. He has become very thin because he does masturbation too much. There was a movie on this, myth buster. Oh my god 3, OMG 3. क्वेश्चन 2 नए नोट्स में है, पुराने नोट्स में शायद नहीं होगा, इसीलिए नए नोट्स में थोड़े बहुत अपडेट्स ऐड करने पड़ते हैं. कल्चर बाउंड सिंड्रोम वाज एन अपडेट. Have you heard people telling that because of nightfall I am becoming weak? How can nightfall, you understand nightfall, swapna dosh, make a person feel weak? Because they say loss of semen is loss of energy. I am losing semen, so I am becoming weak. You know, one boy came and told me, sir, 30 drop of blood make 1 drop of semen. I said, really? Where did you read it? Tell me the physiology book that writes 30 drop of blood make 1 drop of semen. You know what is AMOC syndrome? AMOC. Violent, aggressive and homicidal behavior. Seen more with cannabis, but can be seen in this also as a culture bound syndrome. Possession syndrome. Have you heard in some religious setting a group of women being possessed by goddess? I'm saying a group of women, not the single woman. Have you seen some ladies behaving as if goddess has possessed them, talking to the god? These are the 4. Culture bound syndrome seen in India. But I will not show that video in a YouTube class. That video is reserved for my face-to-face class. किसी को याद आ रहा है वो वीडियो माता वाला? Yes, in amok there can be panic, but not always. Good question. Do you know why did I give a question on psychosexual stages? Because students say it is not an important topic. It is a very small topic. It was the last chapter. Let's skip it. What if you skipped only one topic in psychiatry, psychosexual stages? Oral, anal, phallic, latency, and genital. Fear of getting castration. Phallic. Phallic stage in male, Oedipal complex and castration anxiety. Phallic stage is female, Electra complex and penis envying. Why did I put this question in the most important question? Because this topic is very likely to be missed in revision. Do you know why? Because this topic is there in the main notes but may not be there in LRR, definitely not there in DVT. So the chances are that in the last 1 month there are a group of students who only do DVT. Some of them remember the main notes, some of them don't remember the main notes. Now those who remember the main notes get more number of questions correct. Most of the questions will come from DVT. That does not mean everything will come from DVT. And what if something comes from main notes which was not there in DVT? Do you get an idea? The NEET PG exam got postponed by more than 1.5 months. You have time to go through your main notes. During a psychiatric interview, a patient was asked, what is the one thing to do if you find an envelope in the street that is sealed, stamped and addressed? Judgment. Correct. In this, we give our patient a test situation. What will you do if you find an address letter on the roadside? Normal people will say, I will post it. Schizophrenia will say, I will not touch it because the letter has been sent by my enemies. It contains the plan how I will be destroyed and killed. Depression will say, I will not touch the letter, sir. What's the fun in touching the letter? हम नहीं छुएंगे लेटर सर. हम छू के भी क्या करेंगे? जिसने भेजा वो भी मरेगा, जो नहीं भेजा वो भी मरेगा. Very good. You people remember the examples also. Do you know why? Because from last many years I am not changing the example. So that if you attend the class second time, not only the theory gets reinforced, even the example get reinforced. It's not that I don't know other examples. I know. See, I teach you psychiatry for 10-20 hours. That does not mean I only know that 10-20 hours of psychiatry. ऐसा नहीं है कि मैं जितना पढ़ाता हूँ मुझे उतना ही आता है. थोड़ा ज़्यादा आता है उससे. हाँ, थोड़ा ज़्यादा. So I feel that if I keep the example same, you connect better. Address letter on the roadside. Did I discuss this question ever in the class? A patient was asked similarity between table and chair and the patient replied, both have 4 legs. Did I discuss this question ever in the class? चार टांगे हैं. Come on. Come on. And when the student sent me this question, he replied, sir, what is abnormal in him? He is normal only, no? I replied to the student, he is not normal. You are also concrete. That's why you think he is normal. In order to handle other concrete, you have to have good abstractability. If the person says both are furnitures, that is functional similarity, then it is good abstractability. If he says both are four legs, that is structural similarity. In similarity test, if the patient gives functional similarity, it is abstract. If the patient gives structural similarity, it is concrete. Do you get it? What is the similarity between cow and buffalo? What is the similarity between cow and buffalo? गाय और भैंस में क्या समानता है? हाँ, both give milk, both are cattles, both are animals. If you say both have four legs, चार टांगे हैं, then you are concrete. Very good. As per the current hypothesis, which neurotransmitter excess is implicated in both positive and negative symptom of schizophrenia? D for dopamine, D for delusions, positive. N for norepinephrine, N for negative. S for serotonin, S for sare, very good. Sare, all, both, positive and negative. Were you able to answer this with my mnemonic? Did anyone remember this sare, all, sabhi, sagde, sarva? क्या किसी को ये mnemonic याद आया था? Very good. So many students in this YouTube class who are already taught by me, who are already known to me. It's so good to see you people dedicating your 1 hour and devoting it for psychiatry live revision. I promise, I ensure you that I will teach you more psychiatry in 1 hour as much as you can read that in 1 hour. Now there are so many students who are watching this video versus so many students who are not watching this video. Suppose this question comes in actual exam of NEET PG or INICET. I want all of you who are attending the session today to mark it right. Will you do this? The biggest reward for me is you getting a question right in psychiatry in exam. And you will get it right. I'm telling you. Psychiatry has been a very scoring part of PG entrance. People do get 5 on 5, 6 on 6 correct. आपके भी आएंगे 5 में से 5, 6 में से 6 ठीक आएंगे. A subject that can give you 100%, one of them is psychiatry. Good. Very good. Keep it up. Do you know that I am going to share this PDF of MIQ with you all in WhatsApp and Telegram? Have you seen my NEET predictor 15 questions? If not, please see, because I have taken one INICET predictor 15 questions, one NEET predictor 15 questions. Both videos on YouTube and PDF on Telegram and WhatsApp. I hope you people are connected to me on Telegram or WhatsApp or Instagram. Anywhere. I try to share it in all the 3 sources. EEG of normal sleep. Of normal sleep, asked in NEET 3 time, INICET 3 time. K complex sleep spindles. Not true. These are seen in NREM 2. True. The disorder is true. Reduced EMG level. True. Rapid eye movements. Yes. All NREM parasomnias. Walking, talking, terrors. Are seen in NREM stage 3 and 4. Except dash seen in NREM 2. Come on. All the NREM parasomnia are seen in walking, talking, terrors, bedwetting are seen in 3 and 4 except bruxism. Predicted question. Nightmare are seen in REM sleep. Answer is bruxism. Bruxism is seen in NREM 2. NREM 1 theta or vertex, NREM 2 K complex sleep spindles, NREM 3 and 4 REM, mixed frequency waves. Do you know how to identify all of them on EEG? Have you all seen my normal sleep and EEG video? Have you all seen my normal sleep and EEG video? Yes, good for you. Psychotherapy of choice for PTSD. Come on. Did anyone mark this correct? Did anyone mark this wrong? Some student mark it as EMDR. EMDR is the new therapy for PTSD. It is available both YouTube as well as eMedicoz. It is a free video, anyone can watch. Very good. CBT में गलत किया था ना? Come on. Depression. Psychotherapy of choice. Phobia. Psychotherapy of choice. Adjustment disorder. Psychotherapy of choice. OCD. Psychotherapy of choice. PTSD. Psychotherapy of choice. Come on, answer. Systemic desensitization. Very good. Exposure and response prevention. That is why you have to make more MCQ practice so that it's better to mark an MCQ wrong here in the class or in the test rather than marking it wrong in exam. Do you agree that the mistake done here should not be repeated in the exam? Students, do remember the mistakes done in previous test. Otherwise, you are likely to repeat the same mistakes in the exam. कोशिश करो कि जो गलतियां करनी है एग्जाम में जाने से पहले ही कर लेना, वहां के लिए कुछ छोड़ेगा ही नहीं गलती करने के लिए. La Belle Indifference, PYQ INICET. Conversion disorder. What is La Belle Indifference? Lack of emotional reactivity to the suffering. Patient has a suffering, but its face fails to show the distress, associated distress with the suffering. Anti-suicidal. Which mood stabilizer has anti-suicidal? Lithium. Can you name one more drug which is anti-suicidal? Shall I tell you one extra edge for INICET? The first drug was carbamazepine, which was converted to epoxide metabolite. This epoxide metabolite causes serious skin side effect, Steven-Johnson syndrome. Then came its next congener, oxcarbazepine. It has less of epoxide metabolite, so less of skin side effect, but unfortunately more of hyponatremia. Are you aware about this? That oxcarb causes more hyponatremia than carb. The same question has been repeated twice in INICET. Are you people aware that there is a newer congener of oxcarb known as eslicarbazepine? Eslicarbazepine is in the new notes and new videos of 2025. It was not there in the old notes and old videos. क्या आप में से किसी को भी eslicarbazepine के बारे में पता है? It has less skin side effect and less hyponatremia. Now what happened when we moved from carb to oxcarb? When we moved from carb to oxcarb had less skin but more hyponatremia. But when we move from ox carb to SLE carb, it has less skin right wet and less hyponatremia. This is already asked. So obviously this is likely to be asked. And if ever a question come on SLE carbazepine, it has to be this. It has to be this. Were you aware about SLE carb? Wow, very good. काफी सारे बच्चों को SLE carb के बारे में ऑलरेडी पता था. बहुत अच्छी बात है. I'm so happy. I thought you didn't know. At least something you learn from this YouTube session, which is not known by you previously. Okay, tell me one thing. Today you came to know about SLE carb. It was not in your previous notes. Now you know about SLE carb. Will you tell it to your friend or don't tell? SLE carb के बारे में पहले आपको पता नहीं था, आज पता चल गया, तो क्या फ्रेंड को बताएंगे? गुड क्वेश्चन ना. कंपटीशन seats are limited, people are more. Now your choice. Which of the following differentiate delirium from dementia? What is the answer? Fluctuating in nature. Although the best to differentiate is altered sensorium, but that's not in the options here. Did you see that I made a MIQ PDF for you? And in that PDF, there's a question, there's an answer, there's an explanation written. I feel if you only see this PDF, it is going to help you. The first thing to be done is to see the PDF. Suppose PDF solves the purpose, then no need to watch the video. If PDF does not solve the purpose and you need more elaboration by me, then watch me. You can watch me anytime, anywhere. You know, student messages me, sir, I can watch your video in 2x. I said, good. Sir, I can watch your video in 3x. Your voice is audible and understandable in 3x. I said, very good. Another student messaged me, sir, I can watch your video while sleeping also. I said, what? Sir, while sleeping. I said, what do you mean? Sir, if I watch your video, I get to sleep. I said, very good. Sir, I watch your video in the washroom. मैंने कहा बस कर, बहुत हो गया. ये जब से हम आपकी जेब में अवेलेबल हुए हैं, आप हमें कभी भी कहीं भी चला देते हैं यार. थोड़ा सा एलिगेंस रखो. You know, few years back we had no app, we had no this online teaching. We used to take only face-to-face lecture, and student used to travel from a long distance just to meet us. Now I travel a long distance to meet students, and I go to a different city to take face-to-face class, and the student messages me, I am watching you from my hostel. मैं हॉस्टल से चल के सेंटर तक नहीं आऊंगा, तुम दिल्ली से चल के चेन्नई आ गया, तेरी गलती. कोई बात, इट्स ओके, योर चॉइस. ट्रेंड्स चेंजिंग. Delirium versus dementia. Attention fluctuates. Fluctuating. The best is altered sensorium. Altered sensorium. Disoriented to time place person. Clear sensorium. Oriented to time place person. The second best is fluctuating. A 35-year-old man with anancastic personality disorder. Do you know what is anancastic? OCPD. The difference between OCD and OCPD is compulsions present, compulsion absent. Perfectionism seen, preoccupation with rules seen, indecisiveness, ambivalency. It is a feature of OCD, not OCPD. Although it can be seen in both. It can be seen in both. You got confused at indecisiveness, na? Indecisiveness, ambivalency is a feature of OCD but can be seen in OCPD. Because OCD-PD people are so perfectionist. They want to do everything perfect. So sometimes they are not able to decide which one is perfect. And keeping everything clean is a compulsion for them. But for OCPD, it is not a compulsion. It is their habit. Keeping everything clean for OCPD is a habit. For OCD is a majburi. Googly question. Were you able to answer this correct? Is it mentioned in your note compulsion are present in OCD and not present in OCPD? Is it mentioned in your notes? अगर आप ध्यान से देखोगे तो OCD और OCPD का यही तो डिफरेंस है. साफ सफाई रखना OCD में मजबूरी है और OCPD में शौक है. बाउंसर. Not a feature of catatonic schizophrenia. Cataplexy is loss of tone on emotional events. Were you able to answer this correct? catalepsy, catatonia, cataplexy, narcolepsy. Some people have marked it wrong. Not correct in bulimia nervosa. Come on. Bulimia. Binge eating, lack of control, compensatory behavior. Are they having weight gain or normal weight? Is bulimia having weight gain or normal weight? Do you people know how to differentiate anorexia versus bulimia? Anorexia is underweight and bulimia is normal weight. What is the mnemonic of anorexia? A, B, C. What is the mnemonic of bulimia? B, C. Do you remember this mnemonic? Very good. The people who have remembered this mnemonic, give me a thumbs up or a like or a love so that I know you remember. आप में से जिसको भी ये A, B, C और B याद है, from main class, from DVT, from LRR, wherever it is, A, B, C and B. Very good. So many people. Oh, so many. अच्छा लग रहा है कि जो याद किया था वो काम आ रहा है, जो पढ़ा था उससे क्वेश्चन निकल रहे हैं. सी, रीडिंग स्टफ, remembering stuff, and reinforcing that I remember. This is known as the positive mindset of the exam. The negative mindset says, I don't remember, I don't remember, I don't remember. The positive mindset says, see, I remember this also, see, I remember this also. देखो ये भी ठीक हो गया, देखो ये भी याद है. There are two ways of looking at things. I don't remember anything, I remember most of the things. You don't say I remember everything, you say I remember most of the things. देखो मुझे ये भी आता है, देखो मुझसे ये भी हो रहा है, मुझे इतना आता है तो मैं पास हो जाऊंगा. I will clear this exam. Come on. It is always mindset. It was always mindset and it will always be always mindset. Defense mechanism not seen in OCD. Projection is the defense mechanism in psychosis. Most important defense mechanism in OCD. Undoing. Undoing, reaction formation, isolation, displacement, repression, reaction formation. 1, 2, 3, 4, 5, 6. There are SIF defense mechanisms seen in OCD. These were the 15 MIQ, and this is the end of today's session. There are so many students who have attended live today. I'm so happy. And for those who have seen its recording, leave a comment whatever you feel like about this session today. I would be happy if you give me any positive, constructive criticism also. If you don't like anything, if you don't understand anything, be comfortable. You can inbox me also. Many of you already have my number and are connected to me on WhatsApp, Facebook, or maybe Instagram, Telegram. So I'm available more than you think I am. Okay. Wish you all the best for your exam. I'll be always there with you whenever you feel the need, any problem, any mental health disturbance. Reach out to me. All the best to all of you. Thank you so much. Dr. Sachin Arora signing off. This PDF is going to come to you in Telegram and WhatsApp after another 10 minutes. Thank you. Bye bye. Have a nice day.